Let's begin with the mass exodus of personnel in our health sector. The management of the Lagos State University Teaching Hospital, LASUTH, has revealed that the hospital has lost about 150 nurses to the Japa syndrome in the last 3 years. At a media parley in Lagos, the chief medical director of the hospital, Professor Adetokunbo Fabanlmwo, said the hospital's exit replacement policy ensures that it is not gravely affected by the exodus. Let's share the story with you.
We're going to have what we call 4 presidential suits.
At this press conference, the task is to reel out the successes of LASUTH in the year 2022. But the scorecard is not without some setbacks, which are on the front burner. The drive is to replace nurses who have relocated.
We've lost more than 150 nurses to the Japa, and they are still migrating.
The exit replacement policy of the government, which is we are the only state which does that, has ensured that that phenomenon has not really affected us too negatively.
The CMD adds his voice on the emergence of new COVID-19 variants by warning that proper scrutiny of travelers from China should be carried out.
We must now clamp the gates at the airports, at the seaports, against Chinese. The burden of that variant is quite huge in China.
He updates the media that LASUTH now has a new 120-bed space building, a renal dialysis center, machines that assist brain surgeries, and equipment that can destroy kidney stones, amongst others.
We are able to go into the blood vessels of the kidney to carry out procedures, blood vessels of the uterus. We're able because we have the personnel and the expertise.
So many areas of healthcare were mentioned by the chief medical director of LASUTH. But one thing he says is key. Lagosians must get registered with the health insurance scheme to ensure they enjoy good health services without financial pressure. Jacqueline Ogo, TVC News, Lagos.
The high point of that story is 150 people recorded that left the system as at last year. And if you want to take record in the last 3 years, I'm sure it's going to be something to, scream about. But that's just the nurses, not talking about medical doctors and everything. So what do you make of this?
Well, I think it's not peculiar to Lagos University Teaching Hospital. It's something that is happening across the country. It's nationwide. And if you will recall, the NMA had come out to also tell us about this problem and the fact that a lot of Nigerian doctors are relocating abroad. I don't have the figure now, so I don't want to just quote any figure. But I also know that we have reported in the past that thousands of doctors, and I'm talking of doctors, have migrated to UK alone, the UK alone, not talking about other Western countries. Personally, I had an experience. I visited the Child Mental Health Center in Oshodi. We do go there for outreaches and to reach out to those people there. By the way, that mental center caters for children with mental cases. A lot of people don't even know that there are children having mental issues. And there, from my interaction, I also realized that a child as younger, their youngest patients at that time was like less than 9 years old. They had 3-4-year-old patients and all of that. And all these issues that deal with palsy and all of that, they take care of them. Now, in that hospital, most of the doctors and the nurses had jackpot. As a matter of fact, as I was discussing with them, the person that I was talking to was about to Japa. So after my discussion, she just smiled. We went back late December. Of course, that person had also Japa'd. And the clinic for children in that hospital is also affiliated to Yaba Psychiatric Hospital. That clinic is short as I talk to you.
Wow.
Where the young children that could be admitted is not functional. And partly
because they've lost
staff.
Personnel.
There are, and that center in Nigeria, I don't think we have more than 2 of that centers in Nigeria. It is supposed to be in each geopolitical zone of the country. I just brought that in to let you know that even when we talk about nurses and all the rest, a lot of us, we are just looking at the general hospital, the teaching hospitals. We are looking at general medical personnel. We are not even going down to look at some of the other critical areas that are being affected. So for 150 people to leave a system within 3 years, I don't see any program that you can put in place that can actually function effectively. I was also in LASUTH, and that is sad because I actually lost a friend.
Wow.
Yeah, and before we took her to that hospital, she told us that please don't take me to LASUTH. If you take me to LASUTH, please, please. In fact, she was pleading, and I still remember that now, that we could just take her to a private hospital, that if we spend the money there, they could just discharge her. She is ready to go and die in the village. That was her plea. But of course, the cost of that private hospital was just too expensive. So we ended up taking her to LASUTH. And I was there myself. Only 2 nurses were available in the all-female ward in that LASUTH as of that time. And it is November last year. All of them have gone. So we have a problem at hand. It's a serious issue that we are contending with. The nurses are going, the doctors are going, everybody is going. The other time, the NMA was telling us that the experienced hands have gone, and the younger ones are going. The experienced hands don't have the people to hand over to. And these experienced hands are getting older, and there is a problem of gap. Who do you train to replace the experienced doctors? Because the younger ones are just not, they can't take what the older doctors and all these nurses have taken. So it's an emergency. And I just need to present it like that. We have a problem at hand.
How do we, forestall this exit migration? Because it seems to be in all sectors.
Yeah, well, fortunately, the horse has escaped from the stable. So it is either you go and catch the horse and bring it back, or you look for a new horse, go and buy a new horse, to put in the stable. We had known for years, for decades, that we had a problem on our hands. Throwing back to 1986, the exodus of medical personnel in 1986 from Nigeria was, ask anybody who knew about the exodus in 1986, 87, it was something else. Now, that is what is going on. So the way out of it is not what I read, was it today, that government was thinking of bringing in foreign doctors and nurses. How can you bring in people, foreign doctors, to your country, when your country to replace your citizens who are moving to other countries? That's an embarrassment. That's ridiculous. You know what the issues are, and they are mainly issues of bread and butter, issues of lack of facilities, issues of lack of equipment, and poor refusal of government to adhere to agreements with the various labor unions in the health sector. The National Association of Resident Doctors has issued a fresh notice that it will go on strike because government has refused to implement its demands. So when we put all these things together, and then comments by certain government officials like the Minister of Labor and Employment, Dr. Chris Ngige, also show that, well, they don't care. Even if there is no doctor in any public hospital in Nigeria, well, the federal government doesn't care, and which is very unfortunate. So this attitude has to change, because these people are being trained at great expense. Medical personnel are being trained at great expense to the country.
Highly subsidized.
Highly subsidized. But now, after training them, you allow them to leave. Because you cannot handle issues around demands, demands about their welfare. You can't do those issues, one. And then two, a lot of countries around the world are actually in need of medical personnel, even teachers. That's another area that Nigeria is going to suffer a huge drain, because I understand even from some countries, even like UK, US, teachers are migrating to some other parts of the world. So now the UK is asking Nigerian teachers to come over. By the time other countries start dangling offers before Nigerian teachers, who is going to be teaching our children? So we have a national emergency across all sectors. Government must sit down and think out solutions. And one of the solutions is treat people well. Treat people in public service well. Because you look at the number of people who love to move from the public service to the private sector. Now it's not just the private sector, they're moving abroad. Sit down, look at your labor, the problems around pay, allowances, equipment, facilities, and all of this, and take necessary actions about these things. Otherwise, the show will go on.